Well, it's time now for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with some new information on health literacy. Hello, Lino.
Hello, Vincent. Health literacy is defined as the capacity to obtain, interpret, and understand basic health information and services, and the competence to use such information and services to enhance health. According to a U.S. National Assessment of Adult Literacy Review from 2003, only 12% of adults in America have a proficient level of health literacy. The issue is a major challenge in many countries in Sub-Saharan Africa. Low levels of health literacy means many people in America, Africa, and around the world have difficulty completing basic health tasks, such as following instructions on how to take a prescription medication. They are also less likely to seek out preventive services like some vaccinations and are more likely to be in poor health. Joining us in the studio to examine the challenge of health literacy in Africa is Erwin Boateng, President of Quality Health Africa, an organization with the mission to strengthen Africa's health system by building sustainable medical facilities. Erwin, welcome to Africa 54.
Thank you very much. It's good to be back.
So let's talk about how we can understand health literacy. Does basic literacy automatically means that one has a good or at least a fair health literacy?
Well, there is a direct correlation between basic literacy and health literacy, but basic literacy alone is not enough to ensure proper health literacy.
So what does it take?
So it takes proper education on health matters for one to be able to know what is needed for them to make sure they're healthy.
So what type of information do people need to know?
So I think when it comes to health literacy, the information people need to know is going up for annual or quarterly checks, the ability to read prescription and follow instruction prescribed by the pharmacist. That's one of the biggest problems that we see. People die from not knowing that they're overdosing on medication.
So according to the report, it is an issue in the United States, especially with the elderly and the poor. What is the situation when it comes to Sub-Saharan Africa?
So when it comes to Sub-Saharan Africa, health literacy is a big issue because majority of the medication that has been provided in those countries are not even in English, so they're not able to read it. And then the nurses and pharmacists themselves also lack quality and skills to be able to prescribe the right medication. There was a case of a 6-month-old who died last week in Ghana because the nurses gave the wrong prescription to the baby.
So who is responsible for increasing health literacy when we look at the situation in Africa specifically?
I think it's a joint effort. Government plays a significant role. But local community leaders also play a good role. The government is responsible for training and making sure we produce skilled healthcare workers. And then it's up to the individuals to also educate themselves to be able to know what kind of medication and practices will increase their life.
And you spoke about some of the instructions that are in English. In a Francophone country, it will be in French.
Correct.
So language is definitely an issue.
Language is a big issue, but I believe if there's a Francophone country, they shouldn't have medication in Arabic. One of my experiences, I went to a pharmacy in Ghana, and it was not even in French. It was actually in Arabic, so I couldn't even read the letters, and the pharmacies were providing that. So that's a big problem with the kinds of medication that are coming into the country.
What about the impact of culture and religion? How do they affect health literacy?
Cultural considerations is also a big factor because there are certain people that have beliefs that they can't take medications because of their beliefs, and that could lead to several deaths. There are several traditions or cultures in Ghana that actually do that. So educating them sometimes helps, just expanding their knowledge on the fact that the medication does not interfere with their religion, but rather prolong their life. They're very receptive of that.
So quickly, where do we start addressing this issue? With basic education, would you say?
Yes, with basic education and basic health education.
Okay.
There's a difference between basic education and basic health education. So we need to have a lot of health fairs and seminars that talk about health literacy and how to promote health literacy.
And you're having such event coming up this week
Yes, we have the summit coming up in Congress on Thursday, October 20th at the Rayburn House.
Okay, great. Well, good luck with the event, and thank you so much for joining us today.
It's a pleasure.
And that was Erwin Boateng, President of Quality Health Africa.